What is the best procedure for crepey and loose neck skin?
When it comes to loose skin under the neck, it's important to determine what factors are contributing to this appearance. These factors include bone volume loss, skin quality, skin quantity, neck position, and even posture. With so many creams, devices, sutures, threads, and procedures claiming to be the best solution for loose neck skin, it can be difficult to choose the best option that's right for you. I'll discuss how I evaluate this area for people who come in with this concern every day in my office. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. A core focus of my practice is to help people with changes associated with facial aging. We do a lot of skin and facial rejuvenation procedures in our practice, including surgical facelifts, neck lifts, as well as minimally invasive and non-surgical treatments. I begin with a history and physical examination. I often learn that a patient has had previous procedures like neck liposuction and skin heating procedures. The evaluation is performed to determine skin thickness, the presence or absence of excess fat, the relative skin elasticity, the relative volume of excess skin, the presence or absence of platysmal bands, the extent of facial bone volume loss, in particular the cheekbones, the chin, the jawline, and jaw angle. The neck skin is different from the skin of the face, so it ages differently. The skin in the neck is thinner than the skin of the face, and this area also doesn't have as many oil and sweat glands as the face. In the situation of a person in their early to mid-40s who's had some skin laxity, but not enough to warrant face or neck lifting surgery, I think what is desired is better structural definition. I always explain to a patient that a young face is not a tight face, and an attractive face is not an over-pulled appearance. It's really about definition. If the issue is skin quality, such as texture and tone, then there are laser treatments in PRP or platelet-rich plasma which can be helpful. Platelet-rich plasma is derived from your own blood and is a concentration of the wound-healing growth factors that stimulate collagen and increase blood supply after an injury. PRP improves neck skin quality and texture by stimulating collagen and fat cells under the skin, thus improving the skin quality. Improving skin quality with PRP is optimal with regular treatment, so improvement can be maximized. We also employ different types of lasers, including fractional CO2, erbium, ND-YAG, and Q-switch laser to improve neck skin. A very popular procedure in our practice is a non-ablative laser toning with the ND-YAG laser. The laser is able to selectively treat the deeper layers of skin without compromising the top layer of skin. I actually developed a protocol where I combine PRP delivery to the skin after laser treatment to maximize the skin quality through collagen stimulation. Radiofrequency devices such as Pellevé can also help with skin toning and tightening of the neck, as well as to induce a similar collagen response. Radiofrequency devices are often employed in place of lasers for people with darker skin, which includes olive Mediterranean skin types, Asian skin, and people with much darker or in the brown spectrum of skin color. Relative volume of skin as well as elasticity is assessed to determine if a minimally invasive procedure called suture suspension may be of benefit. Suture suspension is not a thread lift. A thread lift involves the placement of barbed sutures to try to tighten skin. A suture suspension procedure involves the placement of sutures comparable to those used during surgery. As is what's done in surgery, such as in face and neck lifting, the suture is placed into stable tissue to allow lifting or repositioning of loose tissue. Essentially, it's deep suture placement often used in surgery without skin removal. If you'd like to address skin quantity or excess skin and platysmal bands, then some variation of a facelift, face and neck lift, or even a limited neck lift is considered appropriate. Often, laxity of the neck is associated with laxity of the face. When a patient has loose skin under their neck, I'll show how addressing facial sagging can also address a sagging neck. We can do sometimes a short scarf facelift procedure to be able to accomplish quite a bit. A procedure like this takes about 2 hours to do under local anesthesia with light intravenous sedation. Once it's done, it tends to hold very well and can last anywhere from 5 to 10 years. If platysmal bands are present without excess skin, a neurotoxin such as Botox, Dysport, and Amiya can improve the appearance of those bands. If there is excessive skin and the platysmal bands are lax, there are different ways to modify the platysma surgically, which is done typically during a face and neck lift procedure. In our practice, we do all face and neck lifting surgery under local anesthesia with light IV or intravenous sedation. This is as opposed to general anesthesia, which is often a disincentive for many patients considering surgery. Procedures performed with local anesthesia with sedation allow for easier recovery and allow for people to go back to work sooner. A very important concept which is missed often is the contribution of bone volume loss to neck skin laxity. Particularly for people with limited laxity with a decrease in jawline definition, placement of an implant or long-lasting injectable fillers at the bone level can make a significant impact on your appearance. When the cheeks, jawline, and chin are more well-defined, the relative appearance of the skin under the neck becomes less significant. The decision to choose a procedure or procedures to improve the neck is dependent on proper diagnosis and a clear understanding of the benefits of different interventions. There is a constant evolution in what we do, and being able to perform the full range of procedures from non-surgical and minimally invasive to advanced surgical procedures or a combination has been a successful approach for my patients in my practice. I hope you found this information helpful. Thank you for your question.